Hey, good morning. Madungog ko ninyo. Okay, thank you. Mr. Perez, are you there? Will you please lead the prayer?
Yes, sir. Madungog, sir.
Yes, go ahead.
In the name of the Father, the Son, and the Holy Spirit. Amen. Our Father who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen. In the Father, the Son, and the Holy Spirit. Amen.
Okay, so good morning, everyone. Praise be Jesus and Mary. Amen. So we are down to our last session prior to your midterm exams. So for today, we will try to cover one more area where we can see the applicability of telehealth and telemedicine. Okay, so quick review lang. Unsa bay ato ang gi-cover last meeting? Mr. Alvarez. Tackle the application of telehealth and telemedicine in the areas of psychiatry and mental health. Okay? So gisabot na to no nga uh, in dealing with problems pertaining to mental health, dakong tabang ang telehealth o telemedicine. Okay? Because with limited number of specialized healthcare providers, ma-address na to ang katong gap between healthcare providers and patients who are actually in need of services. Okay? Nga naay kinalaman sa ilahang mental health. So, karong buntag, we will look into another area. I don't know if you find it an interesting area, but I personally think this is one of the more interesting areas where telemedicine actually really plays an important role. Okay, so unsa man ni ato ang ginaistoryahan. Okay, allow me to present my screen. Ipa-confirm lang ko palihog if makita ninyo ang ako ang screen. Okay, so today we will be tackling the area of cardiology, no? So a little overview lang sa mga dili familiar. Cardiology is basically a subdiscipline in medicine which is concerned about the heart of a human person. Okay, so ato ala na siyang i-define formally unya, okay, together with other important or key terms. Basta kay pag mingkag cardiology, na siya kinalaman sa kasing-kasing sa tao. Okay, so for this presentation, we will try to cover the following. So again, magsugod ta sa pag-ila and pagsabot sa mga key terms. Importante ni siya aron makasabot ta unsa ni atong tanaw, unsa ni atong gina-consider, and sa unsang paagi man mosulod and ma-apply si telehealth o si telemedicine. Okay? And then, we'll try to also explore more on cardiovascular diseases, meaning, ato ang sabton, okay, unsa ang mga possible na mga uh, disorders nga ma-experience sa tao nga naay kinalaman sa ilahang kasing-kasing. And as we explore on these different cardiovascular diseases, ato pong i-try og recall unsa di ay ang morabag function sa ato ang kasing-kasing ngano mang maka-experience man ta ani ng mga sakit, no? So atoan na siyang tan-awon niya. And then lastly, we'll look into the need for telemedicine in cardiology. So we will end our presentation in looking into how telemedicine could really be of use in handling cardiovascular diseases. Okay, so muna basically ang dagan sa ito ang presentation karong buntag. So let's start with some key terms. Okay, so formally, cardiology, as defined by Merriam-Webster Dictionary, it is the study of the heart and its action and diseases. So when we say cardiology, dili lang limited sa mga sakit-sakit ang ato ang ginistoryahan diri. Any activity of the heart, from its structure to its function, up to the discovery of some cardiovascular diseases, part na siya sa ginatun-an sa cardiology. Okay? So, mo itong ginaingon ganina nga, murag in a nutshell, pag may cardiology na siya kinalaman sa pagtuon sa kasing-kasing sa tao. Okay? So, I hope klaro unsa nga to ang area of concern today. Next. So, in cardiology, of course, naamang yun tayo mga gina-expect na mga medical experts, okay? Mga healthcare providers. And isa sa mga makita na to, na healthcare provider in cardiology is of course a cardiologist, okay? So pag may nga cardiologist, or usually they are referred by the term cardio, okay? So a cardiologist is a doctor who specializes in treating diseases of the heart. Okay? So pag na kay problema sa kasing-kasing, for example, ikaw personally or a member of the family experiences a cardiovascular disease, and when you go to a healthcare facility, expected na, okay, kaya di ba moagi man na og triage ang pasyente. So sa triage, diha man na masubay kung unsa gyud ba ang ginabati sa pasyente, and after determining, basically, subayon po nila unsa ang extent sa problema. And in cases wherein ang pasyente ga-suffer og something na kinalaman sa ilang kasing-kasing, yeah, normally i-refer yun na dayon sa isa ka cardiologist. Okay? So siya. Next, we also have cardiothoracic surgeon. So pag naana gani sumpay na surgeon, because normally they affix the term surgeon for a more specialized medical professionals or medical experts. Pag surgeon, meaning they are highly specialized in doing surgery, okay, or operations. Okay, so cardiothoracic surgeon specializes in operating on all of the organs of the upper abdomen or the thoracic cavity. So, unlike cardiologists, si cardiothoracic surgeon, of course, has specialty in cardiology, pero more than that, they are known for their specialization and their skills in doing surgery sa mga organs of the upper abdomen. So that includes the heart, the lungs, and all the neighboring organs, again, of the upper abdomen, or mas ilado siya medically as thoracic cavity. Okay, so kung gusto niyo imagine nun, I don't know kung katuod mo sa banda inyong diaphragm. Ang diaphragm, if I'm not mistaken, is beneath our kanang kinaulihi ang rib cage, no? I think diha man na banda. So anything ibabaw ana, that's basically what we refer to as the upper abdomen or the thoracic cavity. So diha man situated ang atong kasing-kasing, ang ato ang lungs, o ang uban pang mga organs. Okay, so mauna ang kaya i-handle sa mga cardiothoracic surgeon. Okay? Napod tayo ginatawag na cardiac surgeon. So, kung si kalainan sa cardiac surgeon, dito sa katong cardiothoracic surgeon. So, si cardiac surgeon is actually a type of cardiothoracic surgeon. Kaya lang siya, ang iyang specialty is purely on the heart. Okay? So, kaya niya mo perform og any operations or any surgery nga naay kinalaman sa kasing-kasing sa tao. Okay? So, more specifically, perhaps problems with the valves, the structures, the veins, and the arteries near the heart, kaya na i-handle sa isa ka cardiac surgeon. So, kini silang tulo, si cardiologist, si cardiothoracic surgeon, si cardiac surgeon, are the healthcare professionals, the medical experts that we actually need in order to address problems of patients with regards to cardiovascular diseases. Okay, so sila nitong mga, I don't know if you are familiar with kanang bypass, heart bypass, nga na ng mga opera ka na ganing basically abrihan ang imuhang kasing-kasing and then examine asa dito ang problema and then try to address the problem. So basically, kini sila ng mga tao ang responsible ana. So importante sila sa cardiology tungod kay kung wala ni sila, wala ning mga tao nga nag-specialize ani, then it will be very difficult to address severe problems of patients with CVDs or cardiovascular diseases. Okay? So unsa man ang cardiovascular disease or CVD? So cardiovascular diseases, so ginagamitan nato na siya acronym na CVD, no? So our group of disorders of the heart and the blood vessels. This is according to World Health Organization. Now, pag moingon taog cardiovascular diseases, dili na sa kay pareho ra na tanan. So as defined by World Health Organization, it's a group of disorders, meaning while most, if not all, really pertains to the heart as the primary organ in trouble, cardiovascular diseases could actually range into many different kinds of problems. So, tinuod, heart ang ato ang murag primary concern, pero the different cardiovascular diseases are actually diseases covering different parts of the heart. Okay? So, tanaw na to na unya, unsa day ang mga examples sa mga cardiovascular disease as we explore CVDs further. Okay, ato apong sabtod, unsa kay mga possible hinungdan aning common na mga cardiovascular diseases. Okay, so that will be our next set of slides. So understanding cardiovascular disease or diseases is key in seeing the importance of telemedicine in the area of cardiology. Okay, especially for CVDs that are really requires immediate response, no? Naamang ko yung mga cardiovascular diseases na very critical ta in terms of access to healthcare services. Kay kung dili dayon maatiman ang pasyente, pwede nila ning ikamatay. Okay, so mo nang crucial kaayo ang presence adtong mga experts na atong gipang identify ganina. Okay? Nya, importante pod na masabtan nato unsa di ang lain-lain namang cardiovascular diseases na abay pwede ra nga dili dayon atimanon, na abay kinahanglan na gyud dayon atimanon, and whatever is the nature of help this disease would need, tanawon na to asa pwede mo sulod si telemedicine. Okay, so balik ko na to. Cardiovascular diseases or CVDs are conditions that affect the structures or functions of the heart. When we say structures, ang atong pasabot din na ang mismong porma sa kasing-kasing. Kay masin paglain-lain tanong nga tao, lain-lain tanong na individual, basically, ang ato ang kasing-kasing should almost exactly be the same in terms of structure. Kaya lang, na ay mga cardiovascular diseases that actually affects the structure of the heart. So niya, ito ang subayon unsa atong ginapasabot. And then, most of the cardiovascular diseases actually has something to do with affecting the functions of the heart. Meaning, in the presence of these cardiovascular diseases, ang ihagyud igon is ang normal function sa imuhang kasing-kasing. Okay, diba? Kabalo naman ta na it's our heart who is responsible for pumping blood to all the other organs in the body. Okay? So, isa na ka function, ka importante nga function ni heart nga pwedeng igon ni cardiovascular disease. Okay, so mo na to ang subayon. So, unsa tong mga examples sa mga cardiovascular diseases? There are several more, no? This list isn't actually exhaustive. Ako lang gi-highlight tong mga sagad ma-experience based on statistics o katong mga sagad nato ma-encounter perhaps based on ato ang mga actual experiences, mga kaila nato nga nagka-problema sa kasing-kasing or unfortunately namatay tungod sa sakit sa kasing-kasing. So, we have the following: arrhythmia. So, if dili ta familiar, arrhythmia basically has something to do with the beating of or the abnormality in the beating of the heart. Okay, so ang kasing-kasing na ana siya murabag normal na beating. Okay? So, I don't know if my memory is correct. Na certain counting na imuhang murabag pwede sundon, and basically katong counting mao to ang equivalent pod na murag tempo, no, sa pagbeat sa imuhang kasing-kasing. So, when we talk of arrhythmia, na ay abnormality with that beating. So, unsa ang mga possible na abnormality? So, pag ang pasyente na ay arrhythmia, ang rhythm sa heartbeat could either be too fast, too slow, or pwedeng na ay irregular rhythm. Pasabot, murag mo paspas, unya murag mo hinay, unya murag mo normal. That's basically what we refer to arrhythmia. Okay? So, isa na siya sa mga known nga mga problems relating to the human heart. Next, we also have congenital heart disease. So, si congenital heart disease, kanitong atong gisuryahan nga, this affects the structure of the heart. usually ma-encounter ni siya sa early stages sa isa ka bata. 'Di ba kay ang bata paggawa sa kalibutan, nagaanam-anam pa lang mapud nag-develop ang mga important organ niya sa lawas. Okay, so when a person, okay, or a child in particular suffers from congenital heart disease, ang pasabot ana na ay abnormality in terms of the development of the heart. So, pag may intag na ay problema or na ay abnormality sa development, possible na wala gyud naka-develop og sakto ang kasing-kasing. So, meaning, na ay mga parts sa kasing-kasing na wala gyud na porma og sakto, no? Wala nakatubo og sakto, and pag-abot sa panahon, that could actually cause serious problems to the person. Okay? Mo na ito ang pasabot sa congenital heart disease. Coronary artery disease has something to do with the arteries. Okay, so pag may kaog coronary artery disease na ay nahitabong inflammation or swelling with the artery. So unya naman tay tan-awon nga video, mas masabtan nato unsa ato ang ginapasabot anang coronary artery disease. Basta kay ang point is naay paghubag, naay inflammation sa imong artery, and because of that naay mga activities sa imong heart nga maapektuhan, like blood supply, okay, normal na beating sa kasing-kasing, things like that. So again, unya sa video na atong tan-awon, mas masabdan nato unsa na si coronary artery disease. Next, we also have myocardial infarction or MI. The others would refer to that as acute myocardial infarction. Pero mas ilado na siya sa term na heart attack. Okay? So, si heart attack mahitabo probably as a result of a coronary artery disease. Okay? So, naay heart attack na mahitabo kung ang pasyente, okay, ang iyang kasing-kasing dili na masuplayan sakto og dugo nga naay dalang oxygen. Okay? So, mahitabo ang heart attack kung katong artery nga mao'y nagasupply og dugo nga naay unod nga oxygen maalihan. Okay, mo bitaw na ningon ta na si heart attack, okay, is often associated to coronary artery disease. Okay, nganong maalihan man tong artery nga nagasupply og dugo tungod adtong coronary artery disease, atong paghubag sa artery. So sometimes it ends up blocking the supply of blood. Okay? So, pagka na mahitabo, maupod na mo result og heart attack. Okay? Naputay heart failure, which is different from heart attack. Nya, pag mayong tag heart failure, wala nagpasabot nga nag-fail na gid completely ang kasing-kasing, to the extent nga wala na gid siya ga-function, wala na siya galihok, patay na ang kasing-kasing. No. Heart failure is basically a term which refers to the abnormal murabaog behavior of the heart. So it's some sort of a malfunction. Napa ang heart ga-function pa sa kaya lang it's not functioning well. Okay, because again of some problems, some of which are brought by coronary artery diseases. Okay, so muna si ano sa tawagan ni heart failure. We also have cardiomyopathy. Okay, so pag mintag cardiomyopathy, naani siya'y kinalaman sa muscle, sa kasing-kasing. Okay, so tungod kay naay problema ang muscle kay di ba ang kasing-kasing most of the organ is made up of muscle. Nya, ang kanang muscle mo man ang nagalihok, naga mo na responsible sa pagpump og dugo. Okay? Nya, because of cardiomyopathy, okay? Murag weaken ang muscles. And because of that, maglisod siya og pump og blood sa ubang part sa imong lawas. Okay? So, that's cardiomyopathy. And then, we also have stroke. So, I don't know how familiar you are of stroke. Si stroke actually, ang pinakamura giniigo niya, dili gyud ang kasing-kasing, pero ang utok sa tao. Kaya lang, apil siya sa tuwang ginamention tungod kay ang hinungdan nga nung magka-problema ang utok sa tao, which results to stroke, is because of the blood supply nga ang naay responsibilidad ang kasing-kasing. So, if for example, ang ato ang brain mawad-an og supply sa oxygen, that's basically one reason, okay, nga nung magka-stroke tungod kay magkaanam-anam og kamatay ang mga brain cells. Again, because of the lack or the absence of blood carrying oxygen. So, kisa man di ang responsible sa pag-supply aning dugo paingon sa ato ang brain. So, it's actually our heart, no? Part sa ato ang cardiovascular system. So, mo na nga gi-appeal nato na siya og lista din ha. It's actually based also from the list of WHO. No? So, if you try to read further, daghan patag kasi klaseng sakit na pwede ma-encounter. Okay, nga mag-fall under cardiovascular diseases. Okay? So far, nasabtan pa ba? Nakasunod pa ba gihapon ta?
Yes, sir.
Okay, so to further understand, no, again, na lang tayo i-share gamay na video. Okay, I'll try to change my shared screen for a while. Okay, please do confirm if makita ninyo ang video. Okay, are you hearing it well? Okay, sige. So for the time being, dungan natong tan-awon ni siya nga video para mas masabtan nato unsa to tong ginaistoryahan nga si cardiovascular disease.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be going through cardiovascular disease. You can find written notes on this topic at ZeroToFinals.com/CVD or in the cardiology section of the Zero to Finals medicine book. Let's jump straight in. So first let's talk about atherosclerosis. Athero basically means soft or porridge-like. Sclerosis is hardening. And atherosclerosis is really a combination of atheromas, which are fatty deposits in the artery wall, and sclerosis, which is the process of hardening or stiffening of the blood vessel wall. Atherosclerosis affects the medium and large arteries in the body, and it's caused by chronic inflammation and activation of the immune system, in the artery wall. So this causes deposits of lipids in the artery wall, followed by the development of fibrous atheromatous plaques. These plaques cause a few different problems. Firstly, they cause stiffening of the artery wall, which leads to hypertension or raised blood pressure. This is caused by the strain on the heart trying to pump blood against an artery wall that won't expand with the extra pressure. So it pumps against that extra resistance and causes higher blood pressure. The second problem is stenosis. So this is a narrowing, because of the plaques, of the space that the blood can flow through in the blood vessel. And this causes reduced blood flow in conditions like angina or peripheral vascular disease. And the third problem is plaque rupture. And this is where the plaque breaks off and gives off something called a thrombus that travels down the vessel and blocks a distal part of that blood vessel, leading to ischemia. And this is the main cause of acute coronary syndrome or heart attacks. So what are the risk factors for developing atherosclerosis? It's quite important to break down these risk factors into modifiable and non-modifiable risk factors. There's nothing we can do about the non-modifiable risk factors, but we can do something about the modifiable ones. So the non-modifiable risk factors are stuff like older age, family history, and being male. And the modifiable risk factors are smoking, alcohol consumption, poor diet, things like eating high sugar or trans fat diets and not eating enough fruits, vegetables and omega-3s, low exercise, obesity, poor sleep and stress. There's certain medical comorbidities that really increase the risk of atherosclerosis, and these should be carefully managed to minimize the risk. And this is stuff like diabetes, type 1 and type 2, hypertension, chronic kidney disease, and then inflammatory conditions such as rheumatoid arthritis, because remember atherosclerosis is an inflammatory process, and atypical antipsychotics that might be used in schizophrenia. So here's a bit of a Tom tip. When you're taking a history from someone who you suspect has atherosclerotic disease, somebody presenting with chest pain or intermittent claudication of their lower limbs, ask them about their exercise tolerance, diet, past medical history, family history, occupation, smoking, and really think about what are their modifiable and non-modifiable risk factors. This will score you really highly in exams and is useful when presenting to seniors or deciding what somebody's risk of having that condition actually is. So what are the end results of atherosclerosis? Well, this is really when somebody has established cardiovascular disease. So there's things like angina, myocardial infarction, transient ischemic attacks, strokes, peripheral vascular disease, and chronic mesenteric ischemia, when there's not enough blood flow to the bowel. Now, how do we prevent cardiovascular disease? Well, you can consider prevention of cardiovascular disease to fall into one of two main categories. Firstly, primary prevention, and that's trying to prevent cardiovascular disease in patients that have never had it, and secondary prevention, and this is when patients already have angina or they've had a heart attack or a TIA, and you're trying to prevent it from happening again. So the first thing is you want to optimize any modifiable risk factors. So you figure out what their modifiable risk factors are and then try to improve them. So you'd give them advice on diet, exercise, weight loss, smoking, alcohol, and treating any of their comorbidities, such as giving them really good control of their diabetes. Then you want to look at primary prevention of cardiovascular disease. And the way we do this in general practice is we perform something called a Q risk score. And at the moment we're on a Q risk 3 score. And this calculates the percentage risk that the patient will have a stroke or an MI in the next 10 years. If they have more than a 10% risk of developing a stroke or a heart attack over the next 10 years, i.e. their Q risk 3 score is above 10%, then NICE recommends that you should start a statin. So the current recommendation is for a atorvastatin 20 milligrams at night. There's a slight exception in that all patients with chronic kidney disease or type 1 diabetes for more than 10 years should automatically be offered atorvastatin 20 milligrams once a day. The NICE guidelines actually recommend checking lipids 3 months after starting a statin and increasing the dose in order to aim for at least a 40% reduction in the non-HDL cholesterol. But I would always check adherence carefully before increasing the dose, because you might find out that the patient doesn't actually take their medication. Next, let's talk about secondary prevention of cardiovascular disease. And secondary prevention is after they've already had a heart attack, angina, a TIA, stroke, and so on. And the way to remember this is with the 4 A's. So the first A is aspirin. The second A is atorvastatin, and after somebody's had cardiovascular disease, we try and get to 80 milligrams of atorvastatin, compared to 20 in primary prevention. The third A is atenolol, or any other beta blocker. Usually we use bisoprolol, and you titrate that beta blocker to the maximum dose that they can tolerate. And the fourth A is an ACE inhibitor. Quite often we use something like ramipril. And again, we titrate this to the maximum dose that they can tolerate based on their blood pressure and their symptoms. Just a final word on the side effects of statins. There's 3 major side effects that it's worth knowing about. The first one is myopathy, and this is where the statins cause some kind of problem with the muscle fibers in the body. So the patient might complain of muscle pain or weakness, and it's worth checking something called a creatine kinase, which is a breakdown product from muscles. And this will tell you whether they're suffering with myopathy or not. The second is it can rarely cause type 2 diabetes or worse, glucose control. And the third thing is very, very rarely statins have been linked with hemorrhagic strokes. But usually the benefits of statins far outweigh the risks, and the newer statins, such as atorvastatin, are usually very well tolerated and have little side effects. So thanks for watching. I hope you found this video helpful.
So far, na-appreciate ang video, naklaro ba sa to ang mga bagay-bagay after watching the video? Okay, so sa video no gipakita, first and foremost gi-explain unsa possibly ang hinungdan sa pagka naay cardiovascular disease among individuals. And another important part of the video is it tries to cover what are the things that can be done, okay? Which is, unya, as we discuss how telemedicine is integrated in cardiology, makita na to nga some of those identified ways in addressing these cardiovascular diseases can actually be achieved with the use of telemedicine. Okay? Now, ang dili lang siguro kayo na to na ma-appreciate because it's kind of technical, katong iyahang gi-discuss nga unsa na mga tambal na ang kinahanglan i-administer sa mga pasyente nga naga-suffer og cardiovascular diseases. Okay? So, ang importanteng take-away nato dito sa video, kung inyohang gitanaw carefully, naay part dito nga gipakita niya nga with a problematic heart, actually ang tao posibleng mag-suffer og lain-laing sakit involving different organs in the body. So, mauna ang kahadlok sa unsa tawag ani, ang kahadlok sa sakit sa kasing-kasing kay pag dili siya maatiman og sakto, it can potentially affect other important organs in the body. Okay? So, ang utok maapektuhan, ang lungs maapektuhan, ang liver maapektuhan, and all other important organs. Okay, so muna nga if dili klaro sa toa before this meeting, if dili klaro sa toa how serious is cardiovascular disease, karon somehow maparealize sa toa nga we really have to consider it very important, because if mapasagdaan, it could actually cause a lot of damage to the human suffering from a cardiovascular disease. Okay, so mubalik ta sa to ang PowerPoint presentation. Okay, pa-confirm na ko palihog if makitaan ang ako ang slide.
Makita, sir.
Okay, sige. So, i-identify na to no unsa ang mga examples sa cardiovascular diseases. Kitanaw na to sa video unsay possible na hinungdan, unsay mga effects, unsay pwede na to buhaton. Okay? Pero ang question siguro na gusto na to mahibalan or matubag is, why does it matter? Nganong kinahanglan man to siya itakil? Nganong kinahanglan man to sa tagaan og panahon nga masabtan og masubay? Okay? Unsa man siya ka-importante? Okay, so importante siya tungod kay if we don't know, actually si CVD ang number 1 nga cause of death globally. And by number 1 pasabot for quite some time, ang kinadaghanang mortality associated actually sa pagkaanaay cardiovascular disease. Okay? So an estimated 17.9 million people died from CVDs in 2016, representing 31% of all global deaths. Okay, so that is pila ka tuig. That's 5 years ago. So kung mag-search ta karon, ang manggawas sa mga statistics usually ingana pa nga mga tuig 2016, 2017, no? So we do not actually know if karon ba, like at least 2019, 2020, 2021 naabay pagtaas or pagbaba ani nga numbers. Okay? But the World Health Organization still considers CVD as the number 1 cause of death globally. So perhaps na siguro gihapoy saktong kadaghanon sa gasuffer og CVD. Okay, so 1 person dies every 36 seconds in the United States from cardiovascular disease. So kung imo subayon no, 1 person dies every 36 seconds. So that's nearly half a minute. Subot na to sa isa ka minuto, halos 2 ka tawo ang mamatay. And then you try to count how many minutes you have in a day. Perhaps ingana po ang number of death on a daily basis. Okay? Yeah. To think, si US isa sa mga na-establish good na health system. So unsa na lang tong mga nasod nga very limited ang resources. No, walay infrastructure, walay healthcare facility, walay equipments, or wala gyud mga healthcare professionals, mga espesyalista na unta pwede makatabang aron ma-reduce ang kadaghanon sa mga mortality associated with the cardiovascular disease. Over 3/4 of CVD deaths take place in low and middle income countries. So, mo ni ang makagool o makasubo kay over 3/4, meaning that's more than 3/4 sa tibuok number of CVD deaths. So, kung na-action tagabala ka dito sa figures nga ato ang nasubay in the United States, all the more nga mabalaka ta for those cases that are happening in low and middle income countries. Usually these are third world countries or mga developing countries sama sa Pilipinas. Okay? So katapang ipang mention, perhaps the lack of facility, the lack of equipment, the lack of experts could possibly be the reasons why anong mas daghan ang CVD deaths no sa mga low and middle income countries. Okay, so I think with these statistics kita na nato no nga yes, there is really a need for this particular discipline in medicine to be given high regard, no, especially for countries which lack resources. Okay? And I believe diha mosulod unsa ka dakong tabang ang pag-integrate sa telehealth o telemedicine sa area ni cardiology. Okay, so let's look into the need for telemedicine in cardiology. Okay, so telemedicine in cardiology can be applied in both primary care and specialized care. Okay, so ato lang pud na i-differentiate no pag mayon taog primary care unsay pasabot, pag mayon tag specialized care unsay pasabot. Para makita nato ang diferensya nila. Pero ma-appreciate nato nga parehong klase sa care magamit nato actually gud si telemedicine. Okay, so in remote municipalities with few inhabitants, primary care is often the only level of health care provided. So pag may tag primary care, this refers to the usual services that are being provided by healthcare facilities. Kanang typical na ma-expect nimo sa healthcare facility. No, kanang part sa ilahang day-to-day operations. That's what we mean with primary care. Okay? So, muna nga in remote municipalities or in areas with limited resources, primary care is often the only, meaning hangtod diha lang ang care na ma-provide sa mga healthcare facilities. Okay? So is that a problem? Perhaps it could be. Okay? This can be a problem especially when there are patients who are suffering from acute coronary diseases. One particular example of a cardiovascular disease which needs immediate care from a healthcare provider or a medical expert. Remember, pag ang kasing-kasing sa tao ang matandog, dako kayo ang tsansa nga immediate care ang iyahang kinahanglanon. Nga naman, sa ato ang gitanaw ganina nga video no, sa ato pong gi-explain, when your heart starts failing, all other organs in your body becomes threatened. Okay? Pwedeng magka-problema ang ubang organ sa imuhang lawas kung ang imuhang kasing-kasing magsugod na og fail. So that's why for patients who are suffering from acute coronary diseases, they actually need immediate care, which unfortunately could not be available in remote municipalities. Okay? So, in primary care, various forms of telecardiology, so basically telecardiology refers to the integration of telehealth and telemedicine in cardiology, okay, or providing services in cardiology through telehealth and telemedicine. Okay? So, various forms of telecardiology may improve the quality of care for cardiovascular diseases. Okay? Unsay mga examples, unsay mga pwede nato mahatag na example sa telecardiology? So naatay teleconsultations, naatay telediagnosis, okay? And we also could consider tele-education. So ato anang subayon, unsa na sila? Okay? So let's start with the use of telecardiology in primary care for the purpose of health promotions. Okay? So, di ba, kung mahinumduman ninyo sa video, gi-emphasize nga uh, ang pag-treat sa cardiovascular disease na ay duha ka klase. Okay? One, when the cardiovascular disease hasn't occurred yet. Basically, that's prevention. And another one is after na nagsuffer ang pasyente from a cardiovascular disease. So, when we talk of health promotions, this actually falls under prevention. Okay? So, before pa man ma-experience sa tao ang cardiovascular disease, pwede sila actually tabangan aron nga ma-reduce nila tong mga risk factors, those things that we identified earlier, especially the modifiable risk factors. Okay? So, telemedicine may be useful in controlling risk factors for coronary artery disease. So, unsay mga specific things that we can do. Okay, so this includes improving blood pressure control. So, ma-associate man nato si blood pressure with the term hypertension. Okay, or ang usual natong ma-encounter nga term ana is high blood, short for high blood pressure. So, with telemedicine, no, isa sa mga pwede niyang tabang as part of health promotions is to look into the blood pressure of patients, okay, which could potentially be used in better controlling high blood pressures. Okay? And then another thing that can be done as part of health promotions, reducing glycohemoglobin. So that's a component of the human blood. Okay? Improving lipid profile. So kung tanaw na to, balik tong video, na-mention dito nga, actually katong plaques na gitawag, especially katong dagko na gyud kaayo, it just starts with the presence of lipids. Okay? Murag mga soft tissues. So, pag may improving lipid profile, masubay dito nga, ang kadaghanon sa imuhang lipid sa lawas, perhaps naalang siya sa normal. Okay, so masubay na siya. So kung makitaan nga sobra ra, then perhaps that actually calls for further analysis. Kay basin ma-develop tuod na siya into plaques and contribute na siya sa pagka-develop ni coronary artery disease. Okay? So, it can also be used as a help in reducing weight and body mass index. So, na yung mga tools nga dili gyud necessarily para i-monitor ang activity sa kasing-kasing, tan-awon kung naabay mga events that could potentially lead to cardiovascular diseases, as simple as applications that can actually educate people and encourage people to reduce weight and body mass index. Dako na siya nga contribution to the reduction of these risk factors. Okay? And then, increasing the success of smoking cessation program. So, cessation basically refers to ending something. No? So, di ba kay mga risk factors man mga modifiable risk factors nga, pwede yun actually nato ma-address. Mao na nga, with telemedicine, okay, health promotions can be actually improved. Okay, question so far? Naipangutana? Sige, so mupadayon ko. If you have questions, again, please feel free to let me know. So aside sa health promotions, magamit po nato si telemedicine for decision support systems. Okay? So as we all know, decision support systems are often used to aid professionals, apil na diha ang mga naa sa healthcare industry, in making decisions through added knowledge and information. So, especially sa mga areas kung asa limited ang resources, walay espesyalista, the presence of decision support helps a lot in determining the next course of action for a patient suffering from a cardiovascular disease. No, so with these added knowledge and information coming from experts, coming from data of patients who suffered from cardiovascular diseases, mas ma-improve pa ang decision making. Okay, especially again for areas na very limited ang resources, walay espesyalista nga maka decide over the situation of the patient. So gamit din ha ang decision support system, or they are often referred to as DSS. Okay, we also have teleconsultation. So teleconsultation allows information exchange between distant healthcare professionals and local healthcare professionals to discuss a clinical case when a specialist is not locally available. So ganina, same scenario, no? Katong ato ang giistoryahan about decision support system. Kung wala or kung limited yun ang resources, especially kung atong ginaistoryahan is human resource, wala specialista available locally, sama sa DSS, having or allowing teleconsultations mean a lot, okay? Because local healthcare professionals can discuss a patient's case to distant healthcare professionals or katong mga experts, kato atong gipang istoryahan ganina. Okay? And because of these consultations, si local healthcare professionals will be educated further on what could be the best course of actions for the patient. Okay, so mao na ang benefit sa teleconsultation. Okay, so we also have telediagnosis. So if you could still remember katong cardiography, okay, so basically that's used to examine the activities of the heart. Okay, pinaagi sa pag-monitor sa beating niya. Okay, so electrocardiography, when integrated with telemedicine, that basically results to teleelectrocardiography, no? And it's becoming a popular modality in telecardiology. So isa sa mga course of action sa mga healthcare professionals in understanding the current problem being faced by a person suffering from a possible cardiovascular disease is to actually examine the behavior of the heart. Okay? So, sa unsang paagi man masubay ang behavior sa kasing-kasing, that's actually through electrocardiography. Okay, so I hope ma-remember ninyo kato si electrocardiogram, katong readings na ma-generate nato, no? Kumusta ang beat sa kasing-kasing. Okay? Now, nganong pwede man nato siya i-integrate sa Or nganong pwede man nato siya i-consider as one particular area kung asa pwede i-integrate si telemedicine. Okay, it can be easily incorporated into the primary care routine due to its great utility and technology's suitability for places with basic infrastructure in poor and remote areas. Ngano to nakaingon? Unlike other machines or equipment, electrocardiography actually requires low-cost technology for transmitting files. So even with slow internet connections, transferring files in electrocardiography is actually feasible. Mo na explanation nato nganong kaingon ta nga pwede gyud kaayo siya i-incorporate sa primary care routine. Okay, especially for places with limited resources, both the facility and the personnel. Okay, so matabangan na to itong mga healthcare facilities nga limited ang resources in actually coming up with the correct diagnosis for a patient who could possibly be suffering from a cardiovascular disease. Okay, so that's what telediagnosis is all about. Okay, now another part of telecardiology is teleechocardiography. Okay, so unsa man na si echocardiography, this has something to do with basically listening to the sound created by your heart. Okay, so that's another some sort of a test that is done to assess the possible problem being encountered by a patient. Okay, so it has also shown to be a promising strategy to enable access to initial cardiology investigation and early diagnosis. So sama sa electrocardiography, si echocardiography, dili pud kaayo siya mo require og high cost na technology. So meaning it can be implemented in areas even with limited technological resources like the internet. Okay, and that is already a big help for these facilities. Na in the absence of experts, they can still actually examine patients and come up with appropriate diagnosis. Okay? Remember, unsa ka importante ang diagnosis. If makahatag ng diagnosis ang isa ka healthcare professional, ang next course of action is actually determined by that diagnosis. So, ang tambal nga ipainom, ang mga test nga i-conduct, all of these are actually attributed to the diagnosis. So, kung dili makakam up og saktong diagnosis, again, because of the absence of a professional, then maglisod po ang mga healthcare facilities in remote areas in addressing the concern of the patient. Okay, but with telediagnosis, it's actually addressed. Okay, we also have teleeducation. So remote educational activities in cardiology for healthcare professionals may help in improving the quality of care. So sa teleeducation, wala pa good necessarily involved na pasyente. Okay? What happens in teleeducation is that healthcare professionals basically learn things. Okay, nga perhaps wala pa nila na-encounter before, or kung na may mga bagong discoveries nga wala pa nahimong kabahin sa kung sa to ilang gitunan in the past, pwede nila tun-an karon. And that happens because of tele-education. So So this can be achieved by having someone, a specialist or an expert, talk about a particular topic in cardiology. So that can be considered teleeducation. So mura ra gyapon siya og typical class setup. Sama na itong ginabuhat. There is one person on one end who will be responsible in basically delivering lectures, doing demonstrations, and then the rest of the participants on the other end are actually audience. Sila tong maminaw, sila tong mutuon sa kung unsa man galing ang itudlo sa ilaha. Okay, so mauto ang application ni telemedicine for primary care. Okay? So, balik ko na to ha. Pag primary care, gani ang atong ginaistoryahan katong mga services that are part of the day-to-day operation of a healthcare facility. Now, adto ta sa specialized care. So in specialized care, telemedicine is even more vital in addressing problems relating to cardiovascular diseases. Okay, so in summary, pag may tag-specialized care, mag-expect ta diri nga ang mga tao nagasuffer na, meaning currently is having a cardiovascular disease, or nagsuffer na, meaning naka-encounter na sila og CVD. So others might be in the rehabilitation stage already. Okay, so tanaw na to sa unsang paagi man pwede na to integrate si telehealth o si telemedicine. Okay, so let's consider heart failure. Okay, so the use of telemedicine strategies to monitor patients with heart failure is aimed at reducing hospitalizations. Okay. Di ba, explain na to ganina nga, si heart failure is one of the known cardiovascular disease. Pag may heart failure, meaning na ay unusual behavior ang kasing-kasing sa tao. So na ay functions ang kasing-kasing nga wala or dili normal. Okay? So wala nagpasabot nga failure ang term gamit, wala na gyud galihok ang or gagana ang kasing-kasing. It's just that it's actually behaving differently, different than normal. Okay, so ang paggamit og telemedicine in monitoring heart failure, ang tumong is likayan ang morabag admission of patients to healthcare facilities. Ngano kanimanggong pag-admit sa pasyente sa mga healthcare facilities, well, it can be looked at a better option, no, kay maatiman sila sakto. It's actually associated with increased morbidity, mortality, and costs. So, imbis na i-require tanan na magpa-admit sa ospital, pwede lang actually in some cases monitoring of the activities of the heart after a heart failure or while the patient is still having heart failure can actually be a better option. Okay? Dili na gyud necessarily nga i-require pang ang pasyente mo adto sa healthcare facility sa ospital para lang magpa-admit. Okay? So, interventions range from using traditional technologies like SMS, so exchange of text messages para i-monitor kumusta ang pasyente, unsay mga gipangbati sa pasyente, and so on and so forth. Okay? Pwede po mo perform og telemonitoring through innovative technologies with wearable devices. So kabalo naman ta karon nga naay mga gadgets, we refer to them as wearable devices, na pwede na nato magamit in monitoring the behavior of the heart. Like for example, i-monitor niya imuhang BP, i-monitor niya ang mga important physiological activities of your heart, and then katong iyang mga readings, pwede na to siya himuong data basihan para mahibalan kumusta ang pasyente at the moment. So that's telemonitoring. Okay? Again, si DSS, Decision Support System, as explained earlier, perhaps makatabang aron mahibalan sa healthcare professional kung unsa gid ang status sa pasyente, and then gets to decide what will be done next. And then also machine learning to predict complications or future complications. So these are all examples of the things that can be done as part of monitoring patients with heart failure. Okay. We can also use telemedicine, okay, in monitoring hypertension. So, explain na po na ito ganina unsa to si hypertension na nasa kinalaman sa increase in the blood pressure. O katong blood pressure na to ang gina-istoryahan. Okay, so telemonitoring strategies can also be applied to control blood pressure. And when we say control, ibalik na to sa normal. Okay? So, katong pagtaas sa blood pressure, again, probably because it's affected by coronary artery disease. Ato ang i-alter, meaning ato ang i-reverse, aron ang imuhang hypertension mabalik sa normal. Okay? Mo na to ang pasabot sa controlling the blood pressure. Okay? So several studies have demonstrated that hypertension telemonitoring strategies with clinical pharmacist involvement have a beneficial short and medium-term impact on BP control. So, ang blood pressure monitoring, usually, this is done through mga equipments. Sa daan nga practice, it's the healthcare professional who tries to actually read your blood pressure. Pero karon kung imuhang subayon sa market, naanay mga ginagmay na mga devices that will allow you to self-manage your blood pressure. Pwede nimo ma-monitor imong blood pressure on a periodic basis. Pero sometimes this is not enough because while we can monitor our blood pressure using these devices, very limited ato ang knowledge on how to actually manage it further. Like for example, nakabalo ka nga taas imuhang blood pressure based dito sa imuhang device nga gigamit. Ang question diha ron, what's next? And to most of us, we don't actually have the knowledge. Wala ta kabalo unsay sunod buhaton. Mao na nga giingon diri, these telemonitoring strategies paired with clinical pharmacists, meaning naay pharmacist nga pwede makahatag sa imuha og idea unsay tambal na tumaron, unsay pwedeng buhaton to aid your hypertension. Nakita nila nga naay short and medium term impact on BP control. Telemedicine can also be used in emergency services. So, mubalik tagamay dito sa ito ang discussion on trauma and emergency cases. No? So, early diagnosis and management of acute coronary syndrome. Okay? That could also be referred to as a heart attack or kato si myocardial infarction. This is made possible through telemedicine. So, even before reaching that point of actually having a heart attack, pwede na siya masubay on an earlier stage thanks to telemedicine. Okay, so kung naa gani murag mabatian kay naamang gyud na if you try to read literatures na may mga signs and symptoms nga pwede nimong himuong basis whether or not you're suffering from a particular cardiovascular disease, a heart attack for example. So in the event nga maka-experience ka ani na mga symptoms or some of these symptoms, you can actually utilize telemedicine and have yourself checked by a healthcare professional for early diagnosis. So even before experiencing an actual heart attack, masubay na kung katubay imong na-experience that is brought by a different illness or that can actually be associated to a possible heart attack. So if ma-detect siya at an early stage, then patients are more lucky kay matagaan na sila og input sa healthcare professional on what to do or what to take aron malikayan nga maka-experience gyud og actual na heart attack. Okay, so this is best achieved with the use of electrocardiogram transmission and with synchronous teleconsultation. So, for example, ang pasyente gitabang, so, diba normally pag naay pasyente nga kanang ginatabang, ang ato ang mindset man gyud is to call an immediate help, diba? So mo na nga in some areas na ay mga kanang emergency lines or hotlines na pwede tawagan, okay, para in kaso na ay pasyente na ginatabang, maadtuan siya dayon, makuha and madala siya sa pinakaduol nga healthcare facility. So for example lang na ay pasyente nga ga-suffer sa somewhere suffering from a cardiovascular disease. So giadtuan siya sa ato ang mga emergency responders, no, mga first responders, or kato atong gitawag gani na EMT last time, if you could still remember. Okay, emergency medical technicians. These are not necessarily doctors, but they are actually trained to check on patients and do appropriate actions to alleviate the suffering of the patients. Nya kay dili lagi na sila gyud dili man gyud na sila doctors, na ani certain limitations sa unsay kaya nila buhaton. Okay? Kay 'di ba? Sila, they are trained as first aiders or first responders. So, if something happens to the patient that is beyond their control and beyond their capacity, dili na nila pwede pakialaman kay that could only harm the patients further. So, in these situations, para maatiman nila sakto ang pasyente, especially while in transit to the hospital, kung naay feature ang katong vehicle, normally it's an ambulance, kung nato siya feature na pwede siya makatransmit og electrocardiograms, no, para while en route sila sa ospital, ginasubay na sa cardiologist what could possibly be the patient suffering from. So, with that, pag abot sa pasyente dito sa healthcare facility, andam na ang mga healthcare professionals unsaon siya pag atiman. Okay? Okay. Dili man nato ma-afford nga kalasan gud ang oras kay again for a cardiovascular disease, time is of the essence, no? Pag dili dayon maatiman, it could actually develop into more diseases or it could actually complicate and affect other organs in the body. So magamit si telemedicine for emergency services. We also have telecardiology on myocardial infarction systems of care. So ganina gisabot na nato no, myocardial infarction, also known as heart attack. Okay? Mahitabo ni siya kung naay pag-undang or naay limitation of blood supply to the heart. Okay? Unsay hinungdan? Si coronary artery disease, katong pag-swell or katong inflammation sa artery nga mo hinungdan nga dili masupplyan og saktong kadaghanon sa dugo ang kasing-kasing. This could result to a heart attack. So, pag mintog myocardial infarction systems of care, these are actually murabag a wide array of different services, okay, that can be categorized into pre-hospital, hospital, and hemodynamic services, which basically ang aim is to ensure that a patient who is potentially suffering from myocardial infarction is treated well. Okay, so si telemedicine pwede na to i-integrate into these systems of care. Okay, it becomes an important component of the so-called systems of care. So, in such cases, patients with acute myocardial infarction are managed in a given region to optimize their management. So, through telemedicine, dili na kinahanglan pa nga ang pasyente dalahon gyud sa mas dako nga ospital or sa ospital nga naay saktong resources. With telemedicine, pwede na actually gyud i-incorporate siya sa katong systems of care so that, again, in the absence of healthcare professionals, ma-treat gihapon or maatiman gihapon sakto ang pasyente who's suffering from a myocardial infarction. Okay? So, telemedicine services play a crucial role in AMI systems of care, okay, as they facilitate better communication. So, ang question, communication of who? Kisa man ang ginatabangan ni telemedicine in terms of better communication. So, communication can actually come from the physician in a low complexity emergency unit or a hospital or a pre-hospital healthcare professional. So, pre-hospital healthcare professional, katuto sila kato mga first responders, first aiders, okay, mga emergency medical technician. Okay, pag may pre-hospital, anything that is off-site, gawa sa hospital, that's actually pre-hospital. So, before pagidala si pasyente sa hospital for triaging, for diagnosis, and for possible admission, by the time nga gitabang siya up until naabot siya dito sa healthcare facility, that's actually part of pre-hospital. Okay, so katong mga tao nga naa sa pre-hospital nga setting ug katong mga tao nga naa sa mga hospitals, nasa healthcare facility with limited resources, possibly sa ilaha gikan ang communication. Now, para asa ang communication? They can actually talk with cardiologists or if necessary, a cardiothoracic surgeon or a cardiac surgeon that are situated at a hub or a hemodynamic center hospital which could actually receive these patients. Pag may kag hemodynamic, mura siya dedicated center for a particular disease. So murag sa SPMC na ay ginatawag na heart center. So as the name suggests, ang mga pasyente nga naa didto katong mga na ay problema sa kasing-kasing. So mura siya og ICU pero dedicated for people who are suffering from cardiovascular diseases. Okay? So usually sa kaingana ng mga facilities, dili gyud na pwede nga walay cardiologist or katong mga other experts. So kani na mga experts pwede actually i-communicate adtong mga tao nga naa sa pre-hospital setting or katong mga healthcare providers pero non-specialist or non-experts. So sa unsang pamaagi sila maka-communicate og tarong through telemedicine. Okay? Telemedicine can also be used for cardiac rehabilitation. So surviving patients who suffered from a heart attack would normally enter a period of rehabilitation. So, in this period, importante ang pag-monitor sa pasyente kung kumusta ang iyahang response sa mga tambal, sa mga test na ginapabuhat sa iyaha. Importante na sa tungod kay diha masubay kung unsa pay iyahang possibly nga gikinahanglan aron sa iyahang full recovery. Okay, so magamit si telemedicine of course through telemonitoring. So ang pasyente, whether naa siya dito sa healthcare facility or naa siya sa ilahang balay, with the use of telemedicine, pwedeng masubay kumusta ang iyahang rehabilitation. Okay? And para masabtan nato nganong gamit siya, normally manggod without telemedicine ang ginabuhat sa pasyente nga gikan nagsuffer og heart attack, patients are actually required to actually do face-to-face consultations with the healthcare provider. So you can think of it or you can imagine kung ikaw tong nasakit na heart attack, simbako, okay, nakasurvive ka, you are very lucky. After ni mo git-treat sa ospital, let's say, gipauli na ka, but because there is a certain period called rehabilitation, kani nga time, constant ang monitoring ani sa imuhang healthcare provider. That's why, from time to time, you will be asked to visit the healthcare provider sa ospital or sa clinic to have a face-to-face sessions. So in the session, i-monitor na po balik ang imuhang kasing-kasing, kumusta, how does it respond to the treatment, and so on and so forth. And then, i-determine on sa mga course of actions. Kaya lang, ang ubang pasyente who have suffered from heart attack, who are currently in the cardiac rehabilitation period, may have difficulties in attending face-to-face sessions. Okay? So, these are considered barriers. So, kung dili makaadto ang pasyente sa face-to-face session, unsay i-monitor sa healthcare provider? Unsaon pag-determine kung naulian na bagyod? Unsaon pagkahibalo kung kinahanglan ba resetahan og dungog na tambal, and so on and so forth. It becomes a problem. But because of telemedicine, maskin pag dili moadto gyud ang pasyente sa clinic or sa hospital kung asa situated ang healthcare provider, still the monitoring could continue. Okay? Still, the consultation could continue. So padayon pud ang pag-atiman sa pasyente. Okay, and lastly, we have remote monitoring using implantable devices. So various implantable devices have been utilized to detect events that could lead to the development of cardiovascular diseases. So implantable devices is different from wearable devices because wearable devices oftentimes are placed on top of the human body. So isuot, ipatong, ingana ang ato ang understanding of wearable devices. We wear them. Implantable devices, on the other hand, are usually implanted inside the human body. Okay? Though pare-pareho na silang purpose. These are actually used to detect events that could actually lead to the development of a cardiovascular disease. So katong mga equipment na ginabutang sa lawas, especially implantable devices, this can actually transmit signals to systems which can be further studied by cardiologists. Okay, so thanks to telemedicine, this becomes possible. So dili na gyud necessarily nga magsige pag-adtuan ng pasyente para lang ma-check ni healthcare provider. Okay, so I think this is our last slide. All right. Sige. Naabay questions? Naklaro sa inyo ha ang mga bagay-bagay? Okay. Clarifications? Apa? Okay, sige. So, if wala na, before I dismiss the class, some announcements lang. This is also in preparation for our upcoming exams. So, I will be posting later tonight the coverage of the exam. Pero if you could recall, katong topics na atong gi-cover since week number 4 up until karon, we are currently on our 6th week. So tanang topics na cover nato adto ng mga semana, that's basically included in the exam. So para lang gid ma-identify niyo sakto, I will be posting the coverage. Okay? So that will be later tonight aron makapangandam mo. Next, I will also be uploading some quizzes for you to work on. Okay, butang nato sa Google Classroom lang na siya tanan. So I will give you ample time before the exam to take the quizzes. Okay, so hulata lang ninyo ma-upload nako to tanang mga quizzes. And then, what else? For today's session, naalang ko'y one last TLA na ihatag just so you appreciate better the integration of telehealth and telemedicine in the cardiology discipline. So other than that, wala na ko yung mga pahabol pa na ipabuhat sa inyo ha. I will be seeing you all during your examination schedule. Okay, so kung for example, naamoy mga pangutana or naamoy mga concerns prior to the exam, please feel free to message me. You can email me your concerns. You can send me a message via our Google Hangouts. Or if you wanted to talk about it now, you can do so. Kaya napamantay saktong oras na mag-discuss. Okay, if wala, then maghulat na lang ko nga naamoy i-send sa kuan na message. And if wala, mas sayo na sa ato ang tanan, no? then I'll be meeting you during your exam schedule. Okay? So, naklaro ba ang mga bagay-bagay? Okay, sige. So kung wala na concerns, we can end our session here. Okay, so I will have to stop the recording and I'll dismiss you already, no? So kita-kits sa inyohang, although dili man gyud required magtan-away, mag face-to-face sa exam, but I'll be checking on you during your examination schedule. Okay, so good luck and God bless sa inyohang mga moabot na mga exams.